Dr. Ranjana Sharma. I am a senior consultant in obstetrics and gynecology at Indraprastha Apollo Hospital, New Delhi. So I'm just going to give you some basic information about polycystic ovarian disease, and very commonly known as PCOD, and it is also known as PCOS, and both are the same things. So I see very commonly now young girls, teenagers, and or young adults, they are coming with the symptoms of polycystic ovarian disease. So I thought it would be really useful for you to know what I'm going to say today. So we actually don't know why it happens, but we have seen a very strong association of PCOD with obesity. So we always suggest that women, especially all girls, should not put on weight, because if you put on weight, you're more likely to develop symptoms of polycystic ovarian disease. And people think it's a disease of ovaries, but actually this disease affects all the systems of the body, and it's not a good disease to have. And it affects very young girls, and they have a whole life in front of them left. So they become more prone to develop diabetes, they are more prone to develop heart problems, high blood pressure, and high cholesterols. So all these problems are multiplied if you have obesity and you also have polycystic ovarian disease. So it is sometimes it's a very difficult question for us to answer. What comes first, polycystic ovarian disease and giving you obesity, or obesity has led to polycystic ovarian disease? So it's like a chicken and egg. So actually we don't know, and we don't want these two together. So it's very important for you to not have this, and what you can do to prevent this is reduce regular exercises and avoid taking junk foods, high calorie food. Why we see more PCODs these days? Maybe because eating habits are different, and behavioral there's a lot of difference if you see in the behavior, lifestyle nowadays. If you compare this with the old times, or with your lifestyle of your mothers and your one generation above, so they had a lot of physical activity to do, but here now we know that we hardly do it. So then what does it cause? So it can, if you have periods, then it can stop you having periods, or it can delay your periods. So you start getting irregular, delayed periods. You start getting no periods for months together, and then there is a period that comes very heavy. This is the period related problem. And then you also develop some male type of features in your body, like you may start losing hair, you can start having abnormal hair on your face, on your rest of the body, and sometimes people have to regularly remove their facial hair to make it acceptable, and they also need some laser treatment for permanent, but still for permanent, if you want to get rid of them permanently, but still the cause is still there, you see, and these symptoms you see, and you can do something about them. But what is happening inside, like you are becoming more prone to diabetes and high blood pressure and heart problems. So what do we do about them? So for them, the first line treatment is proper diet, as I already discussed, avoid high calorie food, high carbohydrate food, and junk food and all that, and then regular exercise. That's the first line treatment, and that will continue lifelong. Sometimes your doctor may ask you to add some medication to improve the hormonal profile, and when it comes to having children, it may interfere with ovulation and can lead to sub fertility. That means you're finding it difficult to become pregnant, and in that case you will need some treatment from your gynecologist or from your infertility specialist. So these are immediate problems of polycystic ovarian disease, but long term is what I told you. Is long-term consequences are also there of polycystic ovarian disease.